Hello guys. So today I have come up with a case of caroticocavernous fistula. This gentleman met with a road traffic accident and sustained rupture of left ICA leading to proptosis of left eye with chemosis and congestion and restriction of eyeball. And this was the DSA showing rupture of left cavernous segment of ICA, and there was back pressure to the ophthalmic vein. That was the cause of his proptosis. So through intervention in cath lab, we did coiling of that particular ruptured part of segment, and you can see there is no flow. However, there was a cross flow from the opposite side PCA and from opposite right ICA. And you can see after 48 hours there is significant decrease in chemosis and proptosis, and patient is discharged. Thank you.